Welcome to the deep dive. We take complex source material, break it all down, and give you the core insights. Today, we're tackling something incredibly vital in healthcare. Staff onboarding. It sounds routine maybe, but it's actually high stakes.
Yeah, our mission here is to sort of unpack a really comprehensive guide we found. It aims to turn this, well, complicated and sometimes risky process into something standardized, compliant, and frankly efficient. We're talking about patient safety, keeping good staff, protecting the hospital's finances, all connected. And, the guide really grabs you from the start. There's this story about Sarah, a new ICU nurse at Denver Memorial. Apparently her orientation was, let's say, lacking, especially on the EHR system and emergency procedures. And she made a medication error, a serious one, directly because the onboarding wasn't good enough, almost cost a patient's life. That story, it just perfectly frames the whole issue, doesn't it? What's really fascinating here and different from other industries is that healthcare onboarding isn't just HR. It's completely tied up with patient safety, complex certifications, and, all that regulation. When you look across the country, it's almost a systemic problem. It really proves that these structured, thorough programs, they're not just nice to haves, they're absolutely fundamental. So, okay, if the human cost isn't enough motivation, let's talk about the money. Because the financial hit from getting this wrong, it's genuinely staggering.
Yeah, I think the guide makes that point really powerfully. We're looking at research, specifically the NSI National Healthcare Retention Report. It basically says structured onboarding is like the biggest thing you can do to cut down on nurse turnover, which is incredibly expensive.
Let's break down those numbers for you. So the national RN turnover rate in 2024, 16.4%. But that number alone doesn't really tell the story. On average, hospitals lose, get this, $61,110 for every single registered nurse that leaves.
$61,000.
Yeah.
Wow. And that's not just their salary, right? It's got to include recruitment, temp staff.
Exactly. Recruitment, temps, lost productivity while the new person ramps up, the admin hassle. It's the total cost of disruption. And when you scale that up, that turnover rate means hospitals are losing somewhere between $5.2 million and $9.0 million every year per facility.
That's a number that should make everyone sit up and pay attention. It just flips the script, doesn't it?
Yeah.
Onboarding isn't an HR expense line. It's a core risk management and retention strategy. And there's more data, right? From Sage Open Nursing.
Yes, that research really shows the ROI. It found that switching from, chaotic onboarding to a structured program, it can cut new hire turnover from almost 50%.
50%, that's unsustainable.
Totally. Down to manageable levels, that's a real measurable advantage in a tight labor market.
And all this is happening with regulators constantly watching.
Oh, absolutely. Given what's at stake with patient care, just one slip up in checking credentials or doing safety training, that can lead to huge fines, audits, serious damage to your reputation. And it's incredibly complex because you're managing state licenses, specialized certs, hospital-specific rules. For everyone from clinical staff to admin, even traveling nurses, they all have different needs.
Okay, so with those risks, financial, human, regulatory being so high, the guide is clear. You have to start managing this way before day one. Let's shift gears then. Let's talk solutions, starting with phase one, pre-boarding and getting day one right. The guide says this really kicks off the moment the offer is accepted, maybe 2 weeks out from the start date. They call it pre-boarding excellence. It's where you secure that commitment.
Right, and the absolute first step, totally non-negotiable, is credential verification setup. This isn't just ticking a box. It's like a safety firewall for patients, licenses, certifications, background checks, drug screens, immunizations. You start that process immediately.
Why so early? What's the benefit?
Because if there's a problem, say a license is delayed, you find out before they're supposed to start. You can fix it without disrupting shifts or patient care. It's proactive risk management.
Makes sense. And linked to that is getting their tech access sorted, technology preparation.
Critically important. You need to set up and actually test their access to everything before they walk in the door. EHR, scheduling, communication platforms, all of it.
I guess that goes back to the Sarah story. A bad login experience on day one.
Exactly. It's not just lost time. It creates instant stress. It makes the new hire feel like the organization isn't ready for them, which, definitely impacts whether they'll stay long term. Modern HR tools can really help streamline this part.
Okay, credentials, tech access. What else for pre-boarding?
The last piece is killing that mountain of paperwork on the first day. Documentation organization. Using secure online portals for digital forms, e-signatures, think I-9s, benefits, direct deposit, get it done beforehand.
So HR can actually welcome them, not just chase signatures.
Precisely. You want day one focused on connection and safety, not admin. That solid pre-boarding sets you up for day one critical foundations. It's a balancing act, really. You need that warm welcome, but you also need serious, immediate safety training.
So day one morning, what are the absolute must-dos?
Personal welcome, definitely get them their badge, make sure access works, but then right away, the initial safety briefing. This is crucial.
What needs to be in that initial briefing? Like the absolute essentials.
It has to cover the core OSHA requirements, things like fire procedures, the hospital-specific emergency codes, basic infection control, and really importantly, initial training on workplace violence prevention. The guide suggests maybe giving them quick reference cards, especially clinical staff heading straight into busy areas.
Okay, safety first. Then what about the afternoon, tackling the big one, the EHR?
Yes. Afternoon focus shifts to the electronic health record system, but not just a lecture. The guide strongly recommends an immediate hands-on introduction using test patients.
Ah, so simulated practice right away. Why is that so important?
It's about learning to fail safely. Practicing on dummy data means if they make a mistake charting wrong, ordering incorrectly, it happens in a safe space, not on a live patient chart.
Mitigating the exact risk Sarah faced.
Exactly. They build muscle memory for critical tasks, charting, ordering, finding info using guided workflows in a controlled environment. It gets them past basic navigation quickly and reduces that initial tech anxiety.
Okay, day one handled. Let's move into phase two. This seems like where the clinical complexity really ramps up. Week one through the first month. How do you safely increase a clinical person's independence?
Yeah, this transition needs to be pretty intensive. Week one medical staff training has several core parts. First up is a regulatory compliance deep dive, and this has to be more than just clicking through generic modules. It needs to be tailored to their specific role.
So like ED nurse training focuses on ED-specific privacy scenarios,
Yeah.
while maybe a clinic nurse gets something different.
Precisely. It has to use role-specific situations for things like I pay and patient privacy. Abstract rules don't stick. The guide actually recommends micro-learning here.
Oh, like small chunks of info.
Yeah, short, digestible segments, maybe delivered daily. It avoids that overwhelming feeling you get from day-long seminars and helps people actually remember it.
Smart. Okay, compliance covered. What about their actual hands-on skills?
That's next. Clinical skills verification. For anyone in a clinical role, you need objective ways to check their competency on fundamental tasks. Operating key equipment, medication safety procedures, emergency response. It should follow established best practices to ensure everyone's assessed consistently.
And technology again. More EHR.
Definitely. Technology mastery. This means more EHR training, but now using more complex, real-world scenarios. Still supervised, of course. The best places are even using simulation environments for this. Dedicated labs or platforms that mimic the real workflow.
Simulation labs sound crucial, especially for high-risk areas like ICU or surgery. Lets them practice under pressure without real consequences.
Exactly. They can handle a simulated patient surge, or a system glitch, or practice a complex order. If they mess up in the sim lab, it's a learning opportunity, not a patient safety event. Builds huge confidence.
It makes total sense. What about the people side of things in that first month?
Can't forget cultural integration. This needs to be structured too. Setting up meetings with key people, not just their boss, and properly matching them with a mentor. Feeling like you fit in, understanding the team dynamics. That's huge for job satisfaction and ultimately whether they stay.
Okay, so after all that intense training in the first few weeks, we hit the 30-day integration milestone. What should we expect by then?
The guide sets clear benchmarks. By day 30, the new hire should be able to handle their routine tasks confidently with minimal hand-holding. They should also show they understand the key emergency protocols for their area. This is usually when the first formal progress review happens.
And a good time to talk about their future.
Absolutely. Initiate that professional development planning. Show them there's a path forward in the organization.
And crucially, asking them how it's going.
Right.
Getting their feedback on the onboarding itself.
Oh, vital. That feedback loop is how you keep the program sharp. You need to know what worked, what didn't, especially as things like technology or rules change. Continuous improvement is key.
Right. So moving beyond the first month, the 90-day mark, why is that time frame so significant?
The 90-day point is, well, it's often seen as the critical transition. The data consistently shows that employees who successfully navigate a good, structured 90-day onboarding are way more likely to stay past their first year.
Directly impacting that massive turnover cost we talked about earlier.
Exactly. So, the 90-day comprehensive assessment needs to look at the whole picture. not just one thing. The guide outlines 4 main areas. First, clinical competency. Can they handle more complex situations now? Advanced skills. Second, team integration. How well are they collaborating? Do they fit the team culture? Third, performance metrics. Start looking at relevant KPIs. Maybe patient satisfaction scores in their unit, compliance rates, things like that. And fourth, a forward-looking career pathway discussion. Where do they see themselves going? What support do they need?
Okay, so we've put in 90 days of intensive, structured effort. How do we actually prove it's working? How do we show that ROI? The guide really emphasizes advanced analytics and reporting here. You can't manage that $61,000 loss per nurse if you aren't measuring the right things. What are those key metrics we absolutely need to track?
You need tangible results. Things like time to productivity, how quickly are they fully up to speed? Those 90-day retention rates are critical. Also, patient satisfaction scores specifically related to areas with new staff, and of course, tracking any compliance incidents involving new hires.
And how do analytics help make sense of that data?
This is where modern systems really shine. You can use predictive analytics. Look at historical data, who stayed, who left, what were their onboarding scores like, to find factors that predict success. For instance, maybe you find that scoring high on the EHR simulation strongly correlates with staying past 6 months. Okay, now you know where to double down your training efforts.
Interesting. So you identify leading indicators.
Exactly. But even more powerful, I think, is cohort analysis. Instead of just seeing a hospital-wide turnover number, you track specific groups over time. Like maybe you track all the night shift LPNs hired in Q1. If that specific group has, say, a 90% turnover after 45 days, that points to a systemic issue with nights, maybe scheduling or support.
Not necessarily an issue with the individuals hired.
Right. It helps you pinpoint the real problem so you can actually fix it. It moves beyond blaming individuals.
That level of insight seems invaluable. And the source material even gave a concrete example, didn't it? Behavioral progression, Inc.
Yeah, a great case study. They use automation within their structured onboarding.
Can cut therapist onboarding time from 4 weeks down to just 2.5. That's impressive efficiency.
It is. And listen to this part because it shows the quality improved too. Their new hires started asking 60% fewer questions.
Wow. 60% fewer questions.
Think about what that means. The onboarding was so clear, so effective, it reduced their uncertainty and anxiety. They felt prepared and could focus on their actual jobs sooner.
That really is proof of concept, isn't it? It brings it all together.
It really does. Exceptional, structured, clinical onboarding. It's just not optional anymore. It's fundamental for patient safety, for staying compliant, and for the financial health of the organization. The core idea we've pulled out today is that structure and compliance, applied consistently across the full 90 days starting before day 1, is how you manage risk and guarantee quality.
So hopefully we've given you that proven framework. From those crucial pre-boarding checks and day 1 EHR practice with test patients, all the way through to that comprehensive 90-day assessment using predictive analytics. This really is the roadmap to turning onboarding from a headache into a strategic advantage. Which leads us to our final thought for you today. Given that finding and keeping great talent really determines success in healthcare now, how quickly can your organization shift? How quickly can you stop seeing onboarding as just some administrative task and start treating it as maybe your single most important competitive edge? Something to think about.